Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Today we are going to look at the embolism and focusing on some important points. The first is, what is an embolus? So an embolus is, it can be solid, liquid or gas. And another thing to note is, it is carried by the blood to a site which is distant from its origin. Next, it is mostly dislodged thrombi. And there comes the pulmonary emboli. So under the pulmonary emboli, it derives primarily from the lower extremities and it is deep vein thrombi. Their effects depend on the size of the embolus and location in which it lodges. Consequently, it may include the right-sided heart failure, right side heart failure, and pulmonary hemorrhages, as well as the sudden death. Next, we move on to the systemic. So what is meant by systemic emboli? They arise primarily from the cardiac, mural or valvular thrombi. So cardiac, mural or valvular thrombi, aortic aneurysms, as well as the atherosclerotic plaques. So whether the embolus causes the tissue infarction depends on the site of the embolization and also the presence or absence of the collateral circulation. Next, we move on to the fat embolism. So fat embolism, it's a syndrome. It is characterized by the pulmonary insufficiency, and also there is the neurologic symptoms. Next, there is anemia, thrombocytopenia. Next, there is also it is seen after fractures of long bones which contain the fatty marrow or after the soft tissue trauma. It is fatal in 10% cases. 10% cases it may be fatal, and the pathogenesis involves both mechanical obstruction and free fatty acids. So there can be mechanical obstruction and also the free fatty acids, and it causes the local injury to the endothelium. To learn and grow daily like this, please do subscribe.